Runners, tight hip flexors. Do you need strength or stretching? A sensation of tightness in the front of the hips can often be experienced by runners during or after a run. Does this mean that you need more stretching? Not necessarily. You may need strength. Most runners attribute a sensation of tightness to something that needs to be stretched, but what most don't realise is that when a muscle becomes fatigued, it can give a sensation of tightness. Muscles that have insufficient strength will therefore fatigue easier, then give a recurrent feeling of tightness. Stretching in these instances would only provide temporary relief. The long-term solution lies in strength. So how do you know if your hip flexors are weak, tight, or both? Here are some of our favourite tests to distinguish. So this is a good home test to test your hip extension or your hip mobility. So what you're going to do in a doorway, and you're going to have, ideally have your back flat against in the doorway here. And this leg, we want to make sure that it's perpendicular to the ground. Okay, so we're going to make sure that this knee here. And then what we're going to do is we're going to lean back into the doorway. And what you do is you're going to arch your back, and then you're going to go flatten your back down into the doorway here. And what you want to see is you want to be able to flatten this arch down without feeling too much of stretching through here. If you really struggle to flatten that down and you're feeling a real stretching through the front there, that's a sign that you need to work on your hip extension mobility. To perform the modified Thomas test, sit on the edge of a bed. Lay back and bring both your knees up towards your chest. Let one leg go and let it hang over the bed. If you have adequate mobility here, your thigh on that side should be at or below parallel to the ground. If you're lacking range of motion, the hip won't relax down. The standing knee to chest test is a good test for hip flexion strength. Standing on the spot, bring your involved knee up as high as you can towards your chest, then let it go. Try and keep the knee up as high as possible. To pass this test, you should be able to maintain this full height for a full 5 seconds. If you see your knee dropping when you let go, it may indicate weakness in the hip flexors. To perform the anterior power line bunkie test, set up in a front plank position with your feet elevated 30 centimetres off the ground. Take one leg off the step so that all your weight is going through the one leg. Ensure that your body, hip and leg remain in a straight line. Hold this position for as long as possible and compare to the other side. A normal test result on this test is 40 seconds with no greater than 10% difference side to side. Whilst this test does challenge the hip flexor muscles, there are obviously other areas that will be stressed by this test. Finally, the most accurate means of testing hip flexor strength out of all these tests is using handheld dynometry. We utilise our state-of-the-art access system to assess, and we look for males being able to produce 35% body weight force and females producing 35% body weight of force. So there you have it. By now you should know if you need strength, mobility or both. So in our next blog, we'll discuss how to address these deficits.